That's 6 of us. So let me go around and do well, I'll call this special meeting of the El Paso County Board of Health to order. And I'll start off by a board member roll call. Let's start off with General Jack Briggs.
Present online.
Vice President Doris Ralston.
Here online.
Mayor Glant Havinyar.
Present online.
Commissioner Lojinos Gonzalez.
Here online.
Commissioner Cami Bremer.
Here online.
Councilman Dave Donaldson. Here. And Dr. Deborah, oh, forgot your last name.
Chan.
Chan,
I'm
Deborah
present on
Chan.
the phone.
Okay. And Dr. Richard Vu? No, Dr. Vu is the only member. It appears to be absent. Our agenda is very simple. I think you've all received a copy of the proposed resolution. And I'm going to open it up to General Briggs to see if he has anything to say to the group. This was brought forward on his recommendation. General Briggs.
Yes, sir. Thank you. And I just wanted to thank everybody for taking the time to do this. The bill has made it out of the House, third reading. And so it's on its way probably to the Senate next. There was an editorial in the Gazette over the weekend, again, saying that if it gets to the governor's desk, this is an easy veto, but you don't know that that's going to happen. So I think this is timely and should be something that gets the point across. You will receive from Marie Suego, the attorney, some talking points that I forwarded to her that are relevant to the ineffectiveness and, in fact, the deleterious effects of safe injection sites, or what is euphemistically called overdose prevention sites. I use that because the longitudinal data from Canada, and you'll see this, indicates that instead of overdoses going down, they are going up as these sites continue to be used in Canada. So that's one talking point that will be there for you. The second is treatment to transition. The advocates will tell you that this is that no one gets treated unless they stay alive. The issue is very few people get treated. It's just a perpetuation of the situation that they happen to be in from an official level, which is again consigning someone to a very deadly practice with no real pathway out other than just don't get yourself killed while you do it. So that's the second talking point, and you'll see that. And then the third talking point really has to do with law enforcement and the increase in criminal activity, or let me put it this way, the decrease in criminal activity. So advocates will say that once you have these sites in place, there's a decrease in activity. You have to go beyond just the talking point there of it's better for crime, because what happens is that law enforcement is disincentivized to patrol and act in those areas because they know that anything that they do in that area will probably not be prosecuted because of the sort of the touchy nature of these. So when you hear people say that crime goes down, it's actually because the cops just kind of give up on that area. And that's where you get some very, very dangerous activity. Just this week, or I think it's this week, there was an article describing the neighborhood of Kensington in Philadelphia. It is a war zone, and it is also a place where the cops have just left. because the city has said that they aren't going to, they're not going to do any law enforcement there when it comes to drugs and homelessness. So all these things together are why I suggested that we have this this resolution from El Paso County, particularly to go forward to our lawmakers, but also to the state Board of Health, so that they understand our perspective on this, because they will be debating this, I believe, in May at their board meeting. I think that that's the topic, that one of the topics that they'll have then. So I'm open to any questions, or I can get off the soapbox here and we can go forward with our lives.
Okay, does anybody have any questions for General Briggs related to this resolution?
Ted, this is Lori Seago. I just wanted to let the board members know that I did forward that email from General Briggs. So hopefully everyone has received that.
Okay, thank you, Lori.
This is Dr. Chan. I just wanted to say that I have reviewed the published literature from Canada, and I'm in support of General Briggs's position.
Okay. Any other board member comments? Lori, correct me if I'm wrong, but I understand that it is not necessary to actually read the resolution into the minutes. Is that correct?
It is not legally necessary. If that's your preference, I certainly can do that, but it's not legally necessary, no.
Okay, let me ask the president. Would anybody like to hear the resolution, have it read to us?
I have a question on that, and it's really because I just don't know. But when we do these resolutions, they're posted where and how are they distributed once we approve, if it got approved, how would it be distributed?
Couldn't Susan do a press release for us?
Standard General Briggs that they are live streamed, and this particular meeting is live streamed on YouTube, and then there's a record that is kept of this meeting.
Since it's live streamed, I know it's a bit of a burden for Lori to do it, but I would prefer that we have it read into the record.
All right, I support that. It looks like Commissioner Gonzalez, you had your hand up?
I was just commenting, I think the public affairs, I think, could actually also do a press release indicating that we've passed this resolution.
Okay.
Oh, this is Lori again. I would also note that all resolutions are posted on the Board of Health's web page on the Public Health website.
Okay, thank you, Lori. In the interest of anyone who might be watching the live stream, then I agree with General Briggs. Lori, if you would read the resolution.
Sure. Resolution of the El Paso County Board of Health.
Before you get started, I believe Glant has a question. I saw her hand go up.
Oh, Glenn.
It wasn't a question, it was just a follow-up, that for something to really have teeth in it, I think we should issue a press release on it as well.
Okay.
It just puts more teeth in it and shows that we're serious as you're sending it up to the state board. You know?
Okay. Yeah, understood. And let's see, Susan, do we have is the newsletter that we put out, is that weekly or monthly?
Pamela, do you want to speak to that? We just put one out, and it's not, there's not another one coming out for a while, so that
Yeah, the agency newsletter comes out on the second Tuesday of each month, so we do have a few weeks before our next one. So, but we could add that information in to the next one and plan on having it there.
I just want to make sure that it gets out in time for people to see it. And if you believe, and I'm kind of leaving this up to, well, I guess you, General Briggs, I don't know the timing on this bill. If we've got a couple of weeks before it goes out, would that be sufficient to put it in the newsletter, or should we do a separate press release? Separate press release.
I-
Separate.
Okay.
I would suggest a separate press release because it's already through the House. So it's,
Okay.
the senators are the ones who need to see this now.
All right. Yeah. Well, let's get to the business at hand first. Let's have Lori read it, and then we'll have a vote, and then we'll discuss how we're going to get it out. Well, I see Commissioner Bremer.
Yes, thank you. Just to clarify, was it a motion from General Briggs and a second from Dr. Chan before we read it?
I haven't gotten that far yet, so I was just about to call for the motion, and I'm going to guess it's going to come from General Briggs, as you stated.
I would move. Well, I figured we would
Let's
probably
read it
hear
first.
and then I would move. Yeah.
That
Let's read
works.
it
Sorry
first.
for the procedural. We have, I think every board does it differently. Generally, when we have a proclamation, it's moved and seconded with a motion, like I move the following resolution and then it's read. But we're good either way. Let's just get it on record.
Okay. Go ahead, Lori.
Resolution of the El Paso County Board of Health. Whereas pursuant to section 25-1-508 CRS, the El Paso County Board of Health, or Board of Health, has the power and duty to develop and promote the public policies needed to secure the conditions necessary for a healthy community in El Paso County, Colorado. And whereas the Board of Health desires to oppose any legislation related to public health issues that are not supported by evidence-based policy or best practices. And whereas Colorado House Bill 24-1028, or HB 24-1028, titled Local Control of Life-Saving Overdose Prevention Centers Act, currently being considered in the Colorado General Assembly 2024 legislative session, would amend section 31-15-906 CRS to allow the governing body of any municipality to authorize the operation of an overdose prevention center within its boundaries. And whereas HB 24-1028 provides no role for local boards of health or public health agencies in the approval or oversight of overdose prevention centers, nor does it outline or require the development of specific criteria for the location and operation of such centers. And whereas, if passed, this legislation could lead to inconsistent public health practices between municipalities within the same community. And whereas while proponents of overdose prevention centers claim that establishing such centers results in the prevention of drug overdoses, a greater opportunity to transition to treatment, and a reduction in crime, there is insufficient evidence to support any of these justifications. And whereas the Board of Health objects to HB 24-1028 because it is not supported by evidence-based policies or practices and does not provide a suitable framework for implementation. Now, therefore, be it resolved that the El Paso County Board of Health hereby opposes the current draft of HB 24-1028 and urges state lawmakers to reject amendments to section 31-15-906 CRS that permit municipalities to establish overdose prevention centers. Moved, seconded, and adopted by the El Paso County Board of Health at a special meeting held on April 11th, 2024 in Colorado Springs, Colorado.
Okay, I'm going to look for a motion now to accept this resolution.
Yeah, Ted, this is Dave Donaldson. If Jack wants to make that motion, I'm happy to second it. If he's not interested in making the motion, I'll move approval.
I am more than happy to move to make the motion to accept the resolution as read.
Okay, we have a motion by General Briggs and a second by Councilman Donaldson. All in favor of accepting this resolution as read, let it be known by saying aye.
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 Any opposed? Okay, and then for the record, I'm going to read through the names again. We have present General Jack Briggs, Commissioner Cami Bremer, Commissioner Lojinos Gonzalez, Councilman Dave Donaldson, Dr. Deborah Chan, Vice President Doris Ralston, Mayor Glant Havinyar, and myself, Ted Colas. That concludes our business unless we have anyone else, any of the other board members, or Susan, do you have anything to bring before the board, what we're gathered?
We
See,
will work on a news and have it for review so we can get it out. As I understand that, is the direction to staff? My
yeah, the
direction?
that's correct, Susan. The direction to staff is to make a press release that just states that we have passed this resolution. And Councilman Donaldson?
Yeah, thanks, Mr. President. I just want to thank Jack Briggs for doing this, for having the initiative and leadership to bring this forward, and I think we're all proud to support it. So thank you, Jack.
Thanks, Jack.
My pleasure, and I want to thank Lori for translating fighter pilot words into the appropriate legalese that we needed for this, so I appreciate it.
All right, well, I'm gonna, Dr. Chan, did you have something?
No, nothing.
Okay. All right. I'm looking for a motion then to adjourn this special meeting of the El Paso County Board of Health. And a second.
Make a motion to adjourn.
Thank you, Glenn.
I'll
And we have a
second.
second. Who was that? Was that Cami?
Dr. Chan.
Dr. Chan?
Yes, yes.
All right. All in favor of adjournment, let it be known by saying aye.
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 Any opposed? All right. Thank you all. I appreciate you breaking into your week to do this special meeting. And again, I second what Councilman Donaldson said. Thank you, General Briggs, for bringing this to our attention and for getting the ball rolling on this. Thank you, everybody. Have a very pleasant rest of your week.
Thank you.
All righty.
too.
Bye-bye.
Thank you. Same
Bye-bye.
to you. Bye-bye.
Bye.